Hi, my name is George. I'm a house call patient. I used to get these arterial fibrillation. It was very frightening. At the time, I went to the hospital. They gave me the medication for it. I was taking the medication, and boom, I turned around, it happened again. So I didn't say anything. Another couple of weeks later, boom, again. They notified me about house calls with doctors. Right away, I called the same time I got it. It was like a dream.
My name is Nancy, and I'm a nurse practitioner. I've been practicing in healthcare for over 30 years.
My name is Kara. I am a social worker. I've been in the profession for about 15 years now. So with the House Calls program, the idea is that the nurse practitioner and the social worker go in together. The first visit is usually a long visit, but it's a great visit because then you really get the history, and it helps the nurse practitioner or physician and the social worker start planning for their future visits.
Nancy came here, was talking to me. Even the first time, I felt like I knew her for 5 years. She says, get that pill and cut it in half. That fibrillation, gone. And I said, why didn't somebody else pick that up? That was a blessing right there when she turned around and did that for me.
When I first met George, I did a medical interview and a physical exam, and we had identified that George has had some cardiac issues and is also under active treatment for prostate cancer. George and I were really able to work together in terms of adjusting his medications and his exercise patterns to live a healthier lifestyle and be free from a lot of those symptoms.
I have a regular routine. I take my reading for the diabetes, then I take my blood pressure, then I do my exercise. Then once in a while, if I get a little bit bored, I sing. Everybody loves somebody sometime. One of my favorites.
George used to reside with his wife, and then unfortunately his wife had passed. So the first time I met him, obviously when you're an older adult, first thing usually for me is, are we meeting our just basic needs, right? Food, rent, gas. A lot of the times, older adults or patients with a lot of chronic medical conditions, they may have 17 doctors or they may have a family doctor, right? But those family doctors and those other specialists may be very busy, and maybe they get 5 or 10 minutes with their physician in the office, and they're not really seeing the other side of things. What happens in people's homes is extremely important to their own well-being. You don't really know a person until you walk into their door.
It's a warm feeling, especially when you live alone. A very warm feeling. You're in your own home, you're more relaxed, it's comfortable, and it's more, it seemed to be more caring. Really a blessing, the whole program.